Alarms are a part of almost all medical equipment, and it's easy to develop some alarm fatigue from the constant beeping. But remember that alarms are there for a reason, and that reason is to keep your patients safe. When you hear an alarm coming from your Plum 360, it means that something has interrupted the delivery of medication through the pump. This video will explain the common alarms and how to quickly resolve any issues to continue the delivery of those important medications. The no action alarm will begin to beep if the pump is turned on but has not been touched for 2 minutes and it is not infusing. This is usually just a helpful alert that you neglected to initiate the infusion after you entered the program, or that you stopped the infusion and didn't turn off the pump. Either push start on your program or turn off the pump and the alarm is resolved. You always have the option of silencing an alarm while you investigate the problem by pressing the alarm pause button on the top of the screen. Distal occlusion alarms will likely be the most common alarm you respond to. It means that something has stopped the flow of medication distal to the pump. In other words, something is stopping flow between the pump and the patient. This could be a kinked or knotted IV tube, it could be a clotted or subcutaneous IV, or it could be a positional IV, simply a bent elbow or wrist kinking the catheter inside of the patient. The Plum 360 has a new feature that will be useful for the positional IV. The pump will attempt to restart the infusion after a distal occlusion alarm for 1 minute. During this time, the alarm will give 3 slow beeps. This signifies a medium priority alarm. If it is able to resume the flow of medication, the alarm will turn off and you will not need to respond to it or do anything with the pump. If after 1 minute the pump is still not able to resume the infusion, the alarm will change to this sound. This pattern of beeps indicates a high priority alarm. And in this case, it means that the pump has stopped attempting to restart on its own, and you will need to respond and assess the situation. Make sure to examine your line for any clamps, kinks, knots, or other reasons for occlusion. Examine the IV site for swelling, redness, or signs of infection, or signs that the IV has gone subcutaneous. Attempt to flush the IV to check for patency. Once you have identified and resolved the issue, restart your pump. Proximal air alarms mean that air has entered the cassette. This could have come from the primary line or the secondary line, and the alarm will be the same. Check to ensure that you still have fluid in both of your IV bags. If it is a bubble that needs to be removed, you can back prime it out of the cassette and into the secondary line. If you don't have a secondary line attached, you can attach a syringe to the secondary port and back prime air into that syringe. If a secondary line is attached and you back prime into it, once you have all of the air from the cassette pushed into the secondary tubing, you can flick and manipulate the tubing to move the bubble up into the chamber at the top of the tube. You could also choose to back prime the bubble all the way up the secondary tubing and into the chamber. However, this may not be the best choice. You will notice that the secondary medication, that for this demonstration is colored yellow, is displaced by the blue primary medication as you back prime. If you back prime the bubble all the way up the secondary tubing, your secondary line will now be completely filled with primary medication. When you restart the pump, depending on the rate that the secondary line is infusing, you may have a lengthy delay in the delivery of that medication. You can avoid this delay by disconnecting the secondary line and attaching an empty syringe to the port. Back prime the air into that syringe and then reattach the secondary line. Now all the medication in that tubing is still from the secondary medication bag, and your medication delivery will not be delayed. Be sure to disinfect your port before attaching the syringe, and disinfecting it before reattaching your line. Also ensure that the end of your secondary tubing never becomes contaminated. Proximal occlusion will alarm when something has stopped flow of fluid above the level of the pump, or proximal to the pump. If you look on the screen, it will tell you if that occlusion is in the A line or the B line. Trace the line back up towards the IV bag, looking for kinks, clamps, or knots. Most likely, you'll find a roller or slide clamp that wasn't opened before starting the IV. Open the clamp and restart the line. Do your best to respond to these alarms quickly. When you hear an alarm, it means that your patient isn't receiving the medication you set up. We want to resolve these issues and ensure that all medications are administered in a safe and effective time frame.